Good evening, everyone. This is Kathy Glazer with the Virginia Early Childhood Foundation, and we're very pleased that you all could spend your evening with us tonight. Welcome to the call. We especially appreciate our speakers who are with us this evening and to share some information about yesterday's released guidance for childcare in relation to COVID-19. This evening, we are joined by Holly Coy, who's Deputy Secretary of Education, Jenna Conway, who's the Chief School Readiness Officer for the Commonwealth, and Tara Ragland, who is the Director of the Division of Licensing Programs for the Department of Social Services, and Barb Newland, who is the Director of the Division of Child Care and Early Childhood Development at the Department of Social Services. Appreciate everybody taking some time, and especially these folks for being willing to join this evening to make it more feasible for our providers to join and ask some questions. We're going to start off by hearing a little bit from the state officials about the details of the guidance, and then we're going to offer a chance for questions and answers. And what we'll do is ask folks to type your questions in the chat box, and you can go ahead and just type those questions whenever you have a question that you'd like to ask, and we'll get to them as we can throughout the presentation. I think first I'm going to welcome Holly Coy and ask her to bring some greetings for us this evening. Holly.
Thank you, Kathy. Good evening, everyone. This is Holly Coy, Deputy Secretary of Education. And on behalf of the Secretary of Education and my colleague, Gina Berger, Deputy Secretary of Health and Human Resources, who had another commitment at this time, and her secretary, just want to first start by thanking each and every one of you for the work that you are doing with our children each and every day, especially amidst this strange new reality of COVID-19 in the Commonwealth. We're just so grateful for your commitment and the creativity and the passion to which you are serving those children right now during this really difficult time. I just want to start this evening by also recognizing that our families are experiencing the chaos of this new strange reality as families, not as individuals who are siloed between state agencies. And so as an administration, we want to make sure that whether it's the K-12 school side where I spend my time or the daycare side of things, that we're equipping families with information that they need and equipping you all to do your jobs effectively and addressing concerns as this situation continues to evolve. It's evolving rapidly and guidance is changing by the day. And so we know that makes your jobs hard, but just really appreciate your commitment to serving our kids despite all of that. So just thank you all for being here, and I look forward to the rest of the conversation with you all.
Thank you, Holly. And I'm sure it'll be no surprise and no real change for folks to hear children in the background as we have our conversation this evening. So we welcome that and love to hear those children's voices. I think at this point, I'll turn it over to Jenna, and I see folks have already started to enter their questions in the chat box. That's terrific. Please keep it up and we'll get to them as we can. Jenna?
Thank you. Thank you, Kathy, and thank you, Holly. And thank you to everybody who was able to join us this evening. As Holly and Kathy noted, there's a lot going on. It's an incredibly challenging time, really unprecedented, and we deeply appreciate folks spending some time with us. I wanted to provide a little bit of context about where we're at, what we're talking about tonight, this guidance, some of the additional flexibility that the state is providing, and really ask my colleagues, Tara Ragland and Barb Newland, to kind of take you through some of those details of the guidance that came out. You've heard the governor now talk about it at two press conferences, and really wanted to kind of walk you through that. But before doing that, wanted to take a step back and explain how the administration feels about you, how critical that you are, and how sort of deeply we appreciate the work that you've been doing. As Holly said, and as I'll probably say many times tonight, this is an unprecedented circumstance, unprecedented pandemic that affects sort of every state in our country, and therefore there's a lot of news and guidance and information coming out at the federal, state, and local level and we understand that it's almost too much at times. And so really trying to kind of figure out how do we get good, clear guidance to those of you who are serving our kids every day. We want to be clear that you all are essential. We recognize that you all are the front line, and we need you in order to keep our sort of healthcare providers whole as we respond to this pandemic and keep our society running. We have heard, particularly over the last week, that you need more from us. We need additional guidance is needed and support is needed. And I think most distinctly, we've heard this really since the governor came out and closed all K-12 schools and really kind of put everybody kind of at rest, everybody asking questions, right? So what do we do with all of our school-age kids, and what does this mean for childcare? How do we keep operating and keep kids healthy and safe? And that is the exact right dilemma that you all are grappling with and we are grappling with, and the intent of tonight is to provide guidance for you. Across our agencies, we are working on these questions, and the two things that we are grappling with: how do we keep Virginians safe, right? Both our young Virginians, our infants, our toddlers, our preschoolers, our young school age, as well as our older Virginians, including many of the educators and the personnel that you have. And how do we keep our essential services functioning? And you'll hear us talking about this tonight. Essential services, obviously what first comes to mind is our healthcare system, really kind of ensuring that can function as we expect it to be really inundated over the course of the next days and weeks, but also our first responders and also our other kind of essential services: food, electricity, utilities, water, sanitation, transportation, that enable society to function. And at the crux of that is where childcare sits, right? As we're balancing between how to keep yourself, your family safe, your kids safe, your employees safe, but how do we also sort of support you so that we as a Commonwealth can keep our society running? And that's the balancing act that we're trying to strike. We're working kind of not only across education and health and human services, but we're working with public safety, we're working with public health, we're working with food and nutrition. The work that you do enables all of that, because it's adults that run all of these systems, and those adults have children, and you take care of those children. And so what we've tried to achieve with this first set of guidance is some advice to you and sort of guidance on how do I proceed forward. We do not think we can unilaterally close childcare. Rather, what we're proposing is a real focus on keeping childcare open, particularly for the children of our essential personnel, which is broadly defined as our sort of healthcare professions, our first responders, and another kind of set of public and private employees that enable society to function. And we'll talk in more detail about that. But also provide you with additional guidance. If you need to stay open in order to serve these personnel that help society run, what can you do to keep your kids safe? What can you do to keep your employees safe? What can you do to keep yourself safe? And so that's the balancing act that this guidance seeks to provide. And then, as Barb would note, we're also really thinking about who are most vulnerable, who are sort of most disadvantaged. And so providing some flexibility within the child care subsidy program, looking at how we're addressing absences, thinking about sort of additional resources for you to kind of make sure that the 25,000 kids and families served by the child care subsidy program can be supported and sustained during this incredibly difficult time. You'll hear me say unprecedented a lot. You've probably heard me say it multiple times. You'll also hear me sort of say this is as of today, and you'll probably hear the same from Tara and Barb. We don't know. Things, as Holly sort of noted and as Kathy alluded to at the beginning, are really changing by the hour. Each day, the governor is doing a press release or press announcement, at 11 a.m. It was shifted today because of the presidential press conference, but you can expect every day at 11 to be able to go to Facebook or to go to your TV or turn on your radio and hear from the governor in terms of what's happening. As a heads up, we encourage you to especially listen tomorrow, as the governor and first lady will be providing a direct message to the kids of the Commonwealth, right, and to the families that are trying to meet the needs of this kid during this extraordinary time. We think this is phase one of the guidance. We knew and we heard from you over the course of the last week that you needed more, and that's why this letter and the work across the agencies to provide this, and that's why we have some of the flexibility that you'll hear from the subsidy program. As you'll hear Tara and Barb talk about, we also understand that the world is changing, and this can only be thought of as phase one. you'll give us feedback tonight in the same way that the folks earlier this afternoon gave us feedback on things we should think about, and we'll take that into guidance. And I think you can expect that there will be additional guidance. And so whether it's reaching out to your Smart Beginnings, whether it's reaching out directly to the state, we want to hear from you tonight through the chat box and going forward through email, through phone, through all of the various means of communication to let us know what isn't working, what's happening in your community, and how we can additionally support you. We expect that we not only need childcare now, but there's going to be an additional sort of pressure on childcare in the weeks to come as this public health crisis expands, and we have more and more folks responding to support our health and hospital system. And so again, Tara will talk a little bit about how we're creating a carve-out and how we're sort of working with communities to support you. But know that this is really only phase one. Know that we want to hear from you, and know that we will come back to you, over the course of this crisis to provide you with up-to-date guidance, respond to your needs as they evolve, and work together in government, as Holly noted, because you don't see us as agencies, you see us as the face of the Commonwealth, and you know that's true for your kids, your staff, and your families. So with that, what I'd like to do, if it's okay with Kathy, is to turn it over to Tara to kind of walk us through the guidance that was published, is now available on childcareva.com, as well as on the DSS site. It's the letter that's Dear Child Care Provider and comes from Commissioner Storm. Tara, are you ready to go?
I'm ready. Thanks, Jenna, and thanks everyone on the call. I know how busy everybody is trying to figure out all this new guidance, and we're going to try to walk you through a little bit of that this evening. I understand and echo the sentiments of the folks who've already had the opportunity to talk. We just really appreciate all that you are doing. I want to just take this opportunity to let you know that obviously our whole licensing unit has had to kind of take a step back and reevaluate how we do business in the last week or so. That's, again, I will probably use the same word Jenna used, and dealing with unprecedented issues and unprecedented times. And so, we do ask for your patience, but the one thing that we want to make sure that everybody understands is that we are here as a resource. And I think that the message that I'm trying to make sure that our team in licensing understands is that we're switching from an inspection focus to just being able to be there and be a resource for everyone, because these, new steps and new initiatives that we're going to be taking are fluid, and, today is a new day, and we are going to be here to try to help you and walk you through this. But, I think the biggest thing that we want to get across as well is not to panic and just, step back and realize that we're, this is all new for everyone, but we are here for you, and we know that we're going to get through this. So there's absolutely no doubt that we're going to get through this. So a lot of the guidance that comes out, that has come out from our office, is talking about social distancing and what does that mean. We're trying to limit classrooms and shared spaces to 10 individuals, and that includes the adults in the classroom. There's a lot surrounding what does that look like and how do we do that, and we understand that it's going to be different for a lot of folks. But at the same time, classroom size and ratios aren't necessarily a new thing. We need to be able to look at how we're serving meals in classrooms and try to, separate, kids in unique ways. And again, this is going to be fluid. We're not expecting you to get it right the first time. And we're definitely, not looking to come in and go, oh my gosh, you guys haven't, those kids are too close together. So we just want to make sure that you hear what we're saying. We're trying to be in a more of a supportive role than anything else. We, want to make sure that we're encouraging the staff and the community members to protect their health and safety needs first, and just, take a step back from that as well. Educate your child care community on the signs and symptoms of what's going on with the COVID, so that if you see people that are experiencing that, to make sure they go home and, take care of themselves and make sure that there's those types of things that are going on. We want to ensure that when kids are coming into our program, that maybe we limit and stagger the exits. if at all possible. Try to have a different drop-off point and pick-up point so you don't have that, kids kind of crossing as they are picked up and dropped off. Stagger the play times on the playgrounds. If we can get kids outside, that's what we want to do if it's a pretty day, but we just want to try to keep those numbers of 10, as much as possible, understanding that it's very difficult. The importance of the hand washing and the infection control piece, ensuring that they're washing their hands for the 20 seconds and not touching their eyes, nose, and mouth. And I don't know about you guys, but I just feel like that every time that I turn around, I'm realizing that I'm doing something or touching something that I probably need to go back and wash my hands or use some hand sanitizer for. And so it's like you realize 100 times a day that, oh my gosh, this is definitely a unique situation here. We want to alter programming to increase distance between the children, such as allowing one person in the classroom and outside the classroom at a time, which those can be some difficult things. And just, be realistic with the social distancing. There are going to be things that we have to compensate for and understand we're not always going to get it right the first time.
Tara, you with us? Let's see.
Sorry, can you guys hear me? Something I kind of dropped off there a little bit. I think I was talking to myself.
We can hear you again. You did drop off for a while, but welcome back.
Okay, sorry about that. One of the things we want to talk about too, and just remind you of, is we asked for those classroom sizes. People have called and we've received a lot of correspondence about, the partitions and can we, how do we make these spaces and to keep, kids tend to, in a classroom of 10, can we use partitions? Can we use bookcases and those types of things? And I think it's just important that we realize, again, whatever we can do to try to keep folks in those areas. Sometimes we're going to have to really come up with some unique ideas, physically rearrange the rooms. And I think that we have, some guidance that should be coming out a little bit. We're going to do some FAQs based on this call and some other things that should help you guys so that you can go to our website and look for those types of things as well. I think we want to try to look for some in groups of in terms of planning activities, try to figure out some different things we can do that are unique with, avoid close physical contact between children. We want to refrain from activities that would promote the touching and closeness and hand holding and those types of, but you guys know, it's going to be a challenge. And so, hopefully we can get some resources out and help you guys with that. Anything to add on that, Jenna?
No, I think the other only piece that's not kind of explicitly noted in this guidance, but is worth sort of folks to know, that you can reach out to Tara and the team if, from the kind of how do I serve more, or how do I handle the situation, or if you hear in your community there's you're at capacity and there's not enough kind of capacity, particularly when it relates to healthcare conditions. Some folks might not know that there's some explicit authority that gives the commissioner the ability to adapt and work closely with Tara and her team to be nimble and respond to, kind of providing a carve out or really helping kind of increase access for healthcare and other personnel. So important note, in addition to all of the things that Tara walked us through, as it relates to kind of, staying open and increasing kind of health, safety, and sanitation when you remain open.
I did want to mention one other thing, Jenna, just about the cleaning supplies and things like that. I know that we get a lot of calls about the shortage of cleaning supplies and what to do in the event that there's obviously there's a shortage. nationwide. We are working with even some of the healthcare coalitions to try to figure out how we can ensure that, not just our healthcare providers, but try to figure out how our daycare centers may be able to fit into some of these healthcare coalitions. I think as time goes on, it's going to be more and more difficult, for us in terms of workforce. I don't know, what we're going to be seeing in terms of folks being able to access supplies. We're hoping that supply chain is going to open up, and it'll be there'll be more access instead of less. But I know I was on a call even earlier today just trying to figure out how we could expand some access to things like that. So, if you're having those types of issues and you're not really knowing where to turn, we may not be able to get you exactly where you need to go that day, but just reach out to us and we can try to see if there's some other folks we can put you in contact with. We have, some resources with this coalition where we may be able to assist with getting you at least to the right place. And again, if you guys decide, those of you who are going to remain open, how much we truly appreciate what you're doing and trying to do that, understanding that when different things and challenges arise, we still have our licensing inspectors out there in place. Reach out to those folks that are, for a resource. Ask them to help you. That's what we're going to be here to do, is try to help walk you through each step of this if there's concerns or issues that you have. I think that's, again, one of the biggest messages we want, at least from licensing, that we want you guys to hear.
Sarah, can I add one? Oh, I was going to add one thing that your comment reminded me of, and I think is an important point. So the guidance references essential personnel, folks earlier today asked us, well, what does that include? And as I noted earlier, clearly includes healthcare, clearly includes first responders, but Tara gave a great example of, an essential personnel that might not be at the top of our minds, right? But keeping the supply chain open so that folks, hospitals, childcare programs, sort of, adult centers have access to cleaning supplies is a perfect example of one of the areas as we provide this written guidance, like really refining what constitutes as essential, what doesn't, because if we don't get cleaning supplies to our hospitals and our child care centers, over the course of the next few weeks, things will only get more and more dangerous. So I think that's a one kind of example. And again, we're hoping to get this guidance is now waiting final approval from the governor's sort of task force on this, hopefully get it out no later than tomorrow so folks can have in black and white, here is Virginia's understanding of essential personnel at this point in time.
So if that is Tara's presentation, are we ready for Barb?
I'd say yes, go for it.
Sounds good. So this is Barb Newland, the Director of the Division of Child Care and Early Childhood Development with the Virginia Department of Social Services. And it's, again, it is just an honor to be on the phone with you this evening and talking to you about our situation and some of the things that we are able to change in this child care subsidy program as we all go through this experience. And I echo everyone's sentiments and appreciation for everything that our child care partners are doing throughout the state. You just do an amazing job, and I know these are especially tough circumstances, so thank you, thank you. The child care subsidy program has been able to make several program modifications in light of the COVID-19 situation. And these are temporary program modifications that the Commissioner of Social Services is putting in effect for a 60-day period initially. And these modifications will be assessed at the end of that 60-day period as we make continuing decisions about how we proceed. That's not to say that the the policy and the program and the operations are not receiving ongoing review. They are. We're having ongoing meetings and regular weekly meetings across the executive branch concerning how the program should be operating, and that will absolutely continue. So I will tell you a little bit about some of the modifications to the program that are underway. The first one relates to full-day child care. School-age children that are currently authorized in the subsidy program for part-day child care, and typically that's before and or after school care, will be eligible for full-day child care subsidy. The parent will simply need to contact that local Department of Social Services, and those departments are authorized to, again, authorize that child for a full-day period. A second major modification relates to automatic extension of current eligibility. Families receiving child care subsidies who have their annual eligibility renewal occurring over the next 2 months will automatically have their eligibility extended for 2 months. The third modification relates to the face-to-face interview. The requirement for a face-to-face interview during the child care subsidy application process is temporarily waived, so families can carry out that interview over the telephone. A fourth modification relates to increases in paid absences. The number of paid absences will increase from 36 days to 76 days for licensed child care providers participating in the subsidy program. Those are typically referred to as Level 2 providers. Unlicensed child care providers who previously did not have paid absences available to them will now be able to be paid for up to 76 paid absences also. And the child care provider must be open to be able to be reimbursed for these absences. The fifth area that I wanted to touch on relates to streamlined submission of manual attendance. Families should continue to use their child care swipe cards to register their attendance and trigger payment to the child care provider, as is typical operation for the program. However, when parents cannot swipe, the provider can submit manual attendance. Procedures for receipt of manual attendance are being streamlined, with providers being able to submit their manual attendance via email. And email was typically not accepted in the past. These changes will be, the formal guidance on these will be distributed to the local departments of social services tomorrow. We anticipate that they will be published on the child care microsite, www.childcareva.com, and we anticipate they'll be published there tomorrow also, along with some other frequently asked questions associated with the subsidy program. Information will be disseminated to parents of the children participating in the subsidy program. And let's see, I think the information will be disseminated through a number of additional means. I would like to also remind people that Child Care Aware of Virginia has resource and referral assistance available when families are having difficulties finding child care. So if you are a child care provider and you have updated information about your program, please remember to let Child Care Aware know of any updates to your programs. Parents and individuals can reach Child Care Aware of Virginia online at www.vachildcare.com or by telephone at 866-481-1913. And I'm just quickly checking my notes here. I think those are the most important items that I wanted to share with you this evening. Again, my hats off to all of you for the tough work that you are doing out there on a day-to-day basis. And again, just please know that everyone empathizes and is working hard to assist the child care provider community to the best of our abilities. So thank you all very much.
Thank you, Barb and Tara and Jenna. Really appreciate the overview of the guidance. Jenna, we've gotten a good number of questions in the chat box, and I hope that they'll keep coming. And I didn't know if you would prefer to kind of review those and address those yourself, or do you want me to kind of pitch them to you and Barb and Tara?
I don't mind sort of walking through and then figuring out, kind of offering some insight and then rooting to my colleagues. The first one I see, I think, is a Tara question. Any exclusion to licensing policies if you set up emergency care localities that are not licensed? I think kind of maybe broadly more, or Tara speak to, as folks are setting up emergency care, you know, how they should probably be working with you or letting you know.
Yes, so we would want everybody to contact the licensing office to walk through that. I mean, we've obviously anticipated, you know, some types of things like this. We are encouraging our current providers to be able to obviously step in and fill the gap. That's obviously the best alternative. We have talked a lot about, and forgive the terminology, but we've kind of termed it pop-up daycare, for lack of a better term. You know, we may have to get into doing that in certain areas, and we have some guidance that we are kind of discussing with folks on an individual basis. And so we have, you know, we have some exemptions already carved out within our current regulation that we can walk folks through and help understand maybe where a certain program might fit or what might work for a particular instance. We've recently, we have some guidance, or we have some information ready to go out to try to work with our local hospitals. One of the things that happens in a state of emergency is the folks that have hospital-based systems can automatically increase capacity. So we're trying to see if folks are aware of that, number one. So if they're affiliated with any hospital or medical facility, that they understand and know that. But just reach out to, you know, the licensing in your area, your regional area. You can find that information obviously on the website, but most of you already probably know who your licensing inspector, licensing administrator is, and we can just really try to work to walk through that with you guys. Obviously, we keep saying to everyone that our current providers are the experts. You guys already have first aid, CPR, you have everything that you would possibly need to be able to do this successfully. And I think, as Jenna pointed out earlier, you guys are first responders, and you guys are the experts. So that's who we want to be doing this in a state of emergency, is people who know what they're doing.
Great point, Tara. The next one I'll take as it relates to school, and see if Holly wants to add anything, but confused by different guidelines being given to different age children. If I'm a first responder and also need care for my kindergartner and second grader, but those schools are closed. If keeping systems in place so key personnel can go to work is the biggest concern, is that being addressed for school-age children? And I think that's a very well-made point. I think the first piece was certainly looking at our kids who knew parents were working, and with some disadvantage, and making sure, as Barb talked about, expanding the subsidy program so those kids could access that full day. We know that many of you have figured out how to kind of get more kids to open capacity. As Tara just noted, you're the experts, and so rather than pop up places here and there, if we can have it go to centers. We also heard from others of you that with the sort of new push towards essential personnel, you might not have enough for your classrooms, right? And so we're trying to kind of balance that need. I think that we're recognizing, and I think particularly as this crisis goes on, as Jenna notes here, that we are going to have a challenge with school-age children. I've been using a recent reference. There's basically about 1 million kids age under 10 in the Commonwealth, right? And they can't be left alone, right? They need to be under supervision at all times. And so really, as we work with the governor and the administration to figure out, where do we go from here with K-12? How do we think about childcare? really kind of addressing that there will likely continue to be an additional need for school-age children in addition to infants, toddlers, and preschoolers. So we're working on that, and I think you can expect some more guidance there. We also are, as sort of Tara said, if there are places where localities want to partner with child care providers, there is a kind of a variance process in terms of if schools want to use their spaces for that. And so we're again trying to kind of sort of meet the needs of communities as that comes up. But we are hearing increasingly that school-age children is an issue. Tara, this next one we might need to weigh in and sort of ask folks for kind of creativity and flexibility. But how are breaks to be handled in a 3, 4, or 5-year-old room? We would now need to have 9 kids and 1 teacher for the bulk of the day. Normally 1 staff member rotates and does the breaks. How should it be done under the new guidelines? And that's a very astute question, right? We don't want to have a lot of mixing kind of across groups. Tara, do you want to respond since there's some general guidance on kind of making sense of the new rule of 10?
Yeah, I think that's it's a very good question, and it's kind of a difficult one. One of the trying to maintain your group integrity, I guess maybe for lack of a better term, trying to keep all those kids so that there's, in the event that something would happen, that there would be any, positives that would come up and whatnot. You want to be able to know who those children have come in contact with. So you definitely want to limit contact as much as possible. But I think, we have to be realistic and having somebody, from another adult or whatever, you're going to have to really look at some unique ways. But again, I think maintaining those infection control practices, ensuring that people are washing their hands when they're coming and going between those groups and group interactions is going to be, extremely important. I think you're going to have to, there's going to be those times when you're going to have that cross, back and forth with different classrooms. I mean, been over several scenarios in my head trying to think, what would we do and how do we do it to the best of our ability. And it's just one of the concerns that I have as we move forward is I think we're going to have even more difficulty finding folks to come in and help. And as we see the spread of this happen, how are we going to identify more workforce folks? So I think it's just really trying to maintain good infection control practices and just really making sure that, when we do have folks come in contact with our kids, that we're just doing that hand washing and making sure that, that we have that safe distance. So that's about the best thing that the best advice I can give.
Yeah, and I think the other kind of key point is, but you're using your best guidance based on what we know today. I mean, we talked a little bit earlier around ideally you keep social distance and you avoid mixing groups. Obviously, kids need to be supervised, and if somebody needs to use the restroom or somebody can't come in one day, we understand you're going to have to put another adult with those kids, and we think that's reasonable. I think the things hand washing, sanitizer, all of those things help mitigate that. I mean, I think the other reality around the 6 feet is, that's not really practical or feasible. And a lot of the guidance from CDC and from the Virginia Department of Health, they say to the greatest extent feasible. And again, I think you guys are on the front line of that, of really trying to kind of balance, we can, sort of, if I've got to kind of keep these kids under supervision, I've got to change this diaper, I've got to feed this child has a runny nose, how do I then, wash my hands more frequently, do these other things, because staying 6 feet away or total isolation is simply not possible. Benita's next question is 10 in 400 square feet, how the room is very different than 10 in 800 square feet for a pre-K classroom. Can we have some additional square footage guidance? Sarah, do you want to comment on that, or is that something that, is one would maybe go into kind of phase 2 or down the road guidance?
Well, I just think that given the restraints that we're going to have, I don't think we'd want to get into any square footage type of requirements. I think that we really have to be realistic with what we're dealing with today in this, unique situation. I don't think that we would be concerned about square footage at this particular time. I'm definitely open to discussion on that, and we can continue to look at that.
Then the next question from Samantha is, what happens if 50% of your children are in sort of the medical personnel? Do you exclude them? Do you exclude some of the children? Again, I think there's sort of a two-part answer to this question. I think the first piece is really encouraging you, as soon as we get this out and we owe this to you, this written guidance on what essential personnel is, to understand that is maybe broader than you sort of would initially think, right? And really to kind of share that with your families, engage with your families on, okay, sort of, does your sort of position or work fit in there? And again, there might be somebody who sort of helps deliver supplies, who doesn't work at a hospital, isn't a police officer or firefighter, but might be essential. And then we just ask you to use your best judgment in working with families. We know that this is a tough place. The governor got on this morning and it was really kind of encouraging everybody to take some responsibility. We know that there's still some really small businesses, yourselves included, in these really difficult positions on, do I stay open or not? And that some of your parents are in that very position. And so we want to give you the guidance in writing, both the guidance that came out this week and additional guidance about essential personnel, and then really kind of engage your families to kind of say, how do we make sure that there's enough spots for the folks that we need to kind of keep society function and be able to respond to this health crisis. I think similarly to Tara's point, kind of across the board, across social services and ed, I also think there's not a sort of a judge and jury of essential personnel in terms of people kind of coming behind that. We're trying to kind of be nimble and adjust to kind of the needs of the essential personnel workforce, and we know you're helping us do that. So again, using your best judgment based on that written guidance and based on what your families and your kids need. And I think, as Tara alluded, the practical reality of getting staff in, and sort of increasingly more and more people are self-quarantining. So we know you've got a kind of that balancing act. Can non-licensed programs that typically offer summer camp follow the same process they typically would if they desire to provide emergency care or drop services? Tara, I'm going to give that one to you. Tara, if you're speaking, you might be on mute.
Okay, yeah, well, sorry about that. We do have a couple options probably we can look at, and we would just encourage you to contact us to walk through that. But we do have, come and go programs. We do have a couple different types of not requirements, but a couple different boxes that might fit into. So I think the answer is yes, we can probably work with certain folks on those types of programs.
Will DSS notify us when the 10 in the room will be lifted on that guidance? And notice this is key, kind of the guidelines as of yesterday, right? And Barb talked about the time and date stamp on those shifts. Yes, Susan, we will notify folks. I think you'll notice sort of more and more frequent communication from us as we kind of understand how these sort of the different phases in response to the crisis, but we will notify folks. Tara, there's an ask for your email address. I don't know if you want to kind of give it orally, or if there's a way we could provide an address for that. Do you want to sort of say that now?
Sure, it's Tara, T-A-R-A .Ragland, R-A-G-L-A-N-D Tara.Ragland at dss.virginia, spelled out, .gov. I'm trying to think if there's a way we could get it on there too, but if you go, there may be a link even on our website to it, but
I'll type it in the chat box for you, Tara.
okay.
Hey, Kathy, I just put it in the chat box.
Some great minds.
Thanks, guys. So Monica Jackson noted that providers who decide to support and stay open must be supported with the necessary supplies. And again, now you've got your email address, but we 100% agree and need to provide that support. Cheryl Mormon said, what about providers that are coming up on licensing renewals during this crucial time? Are there extensions in place if programs are closed due to the pandemic? Tara, do you want to take that one?
Yeah, I'll take that. The short answer is yes. We're probably going to push back our renewals a little bit. We are looking at some options to maybe do some desk reviews or something like that, but we're trying to reduce our face-to-face visits. But don't, I would not worry about your renewals. Again, these are unprecedented times, and we do not want folks to have to worry about those types of things in these situations. So we will be, reaching out to each individual as that time approaches. And, we just feel like there's so many other things that you guys really need to be concerned about right now, but that's not one of them. If you do have applications and stuff like that and you can get them in, that's great. But if, for whatever reason that your center is closed, we are going to probably be showing a whole lot of grace with those types of things. But we will have each individual licensing office will be reaching out to folks as those dates approach and discussing what we can do to work through those issues.
Excellent. Thanks, Tara. The next question is from Jocelyn. Is there a minimum amount of time we will be given if we are mandated to close? At this point in time, there's not a mandate to close centers or close family day homes. That's not on the table. We know that has happened in a few other states, and there's been differing kind of time frames in which that is given. The governor has a task force of folks that kind of make these really important decisions about closures, and all we can say right now is that we're trying to provide folks as much notice as we can on any of these major big decisions, but also recognize there's this balancing act around the governor responding to the constantly changing information. And I see this later in terms of how many cases of COVID, how many places have community spread. All of that is factoring into the administration's big decisions. Tizzy said, longer kind of comment from Tizzy about kind of this challenge around keeping groups of children together. I think she recognizes that there are family day homes and very sort of experienced child care professionals who have families that are not working due to sickness or closing, kind of having groups of kids sort of exposes kids, including kind of mixing kids who might be exposed to emergency personnel with grocery stores and, potentially increasing everybody's risk. And I think that's, Tizzy speaks to some of the challenge and the balance here and why we want to kind of provide flexibility, but also understand that, this is going to be kind of, case by case. Many child care providers are self-employed and cannot file for the expanded unemployment despite being regulated by the state. This is a disaster. We need individual care. I think Tizzy raises a good point. I think Tara said the same is true on this kind of, you all are the experts, particularly on our family days home folks on the phone tonight. And, the desire is not to kind of create a whole bunch of new pop-up centers. The desire is to kind of use the current experts, right, the folks who have the background checks and they have years and years of expertise with kids, who are trusted by their community members. We're just trying to kind of open up sort of a lot of avenues kind of across the board. And, and I think certainly as we go and as we have hotspots or areas where there's very pronounced infections, you'll likely see more of a shift to individualized care, and then Tizzy asked, why isn't the state using funding to subsidize care so child care workers can keep getting paid? And again, I think as Barb noted earlier, we're going to continue to look at, what does the sort of sector need? Where's the flexibility on the federal funding? We take those types of decisions to the governor and the task force and kind of continue to bring out shifts in policy, flexibility, additional funding, as we respond to the crisis. The next one from Ashley is on guidance for handling staff with anxiety and other concerns about exposure to COVID-19. Some of my staff live with and care for elderly family members or are themselves in the high-risk category. Some staff are just highly anxious about exposure. This could affect the number of staff available to provide care. It's a great point. I think we can work, maybe Barb, you and I and Tara can work to kind of put out, I know there have been some resources called, and maybe we can add some additional links to childcareva.com on resources. I know that there are resources right now on kids and their anxiety around this, but I think that's a really good reminder, Ashley, about for adults as well, and noting that kind of this is an incredibly scary time, and folks can feel like they're making really kind of momentous life and death choices. I think you guys also actually named the kind of why we're so nervous as this crisis continues around the kind of importance of providing care, and so that there are just going to be staff who are at high risk, right, who meet this kind of CDC criteria of having kind of an underlying condition or at sort of greater risk and are not going to be able to come in. And so really trying to kind of balance, right, maybe fewer kids, you need fewer staff. This is the kind of the balancing act. You want to write the point about some programs are staying open regardless if they're serving essential personnel or not, because they know that they won't receive subsidy payments if they close. The fact that they won't be paid is in turn putting children and providers at risk, simply because they wouldn't be able to afford to close without payment. What do you suggest the Family Day Home or Center do if they know they should be closed because they're not keeping of essential personnel, but can't afford to close because in such cases they would not get the subsidy? Barb, do you want to take a stab at that in terms of, I don't think that's covered in kind of this current round of policy flexibility, but something to kind of to keep in consideration for the future?
Jen, I have to, I absolutely don't have an answer to that question right at this time. So that is one that we will have to record and put on our list. I think one thing that providers would need to think about, though, is if we have a provider that feels like they don't have adequate staff, or they're having that some of their staff members are sick, or they just have they are having difficulty finding staff, to think about if there are peer child care providers that have closed, and perhaps there are staff members there that for a short period of time, maybe, and through these again circumstances, may be able to work at your site.
So Jenna, I had an interesting call yesterday from a provider who was kind of talking through a similar situation. I guess there had been an accusation of why are you staying open if there's no you don't seem to be caring for first responders or healthcare workers. And it was interesting because as we started talking through some things, you realized that there were a couple kids that were in care in her particular, and this was actually a Family Day Home, but she had they were actually janitors in one of the local hospitals there. And I think that we may not initially look at that as an essential employee or an essential person, but I think how much we would miss the mark if we didn't try to have childcare for those types of for their kids. We would really miss the mark because they're really essential. If we didn't have folks to clean our hospitals and to provide those basic needs. And so I think we just have to step back when we see things like that and realize that we may be serving essential personnel and not really even maybe not even know it all the time, or maybe it's just not real evident when you look at a provider. So I think we have to be real careful sometimes when we look into those things and when we start talking about that, because it is a very difficult process to look at, and we all want to make sure that we're just doing right by everybody, and we understand it's just difficult times. So
yeah, no, and I think, and that's a very good point, Barb and Tara, and I think even Jenna's next question has to do with why haven't we even had more people tested, right? What's the holdup? Clearly the majority of the hospital staff around the personnel around the state haven't been tested yet, and so at this stage of the spread I find that frightening. And I think, Jenna, we have to agree. I don't think anybody on the phone today can speak to the details of the testing, but I just think that underlying sentiment about all of us being really scary and frightening is true. And I think it's true for your employees and as well as for your kids and for your families. Jamie's next point is about that many providers are concerned that they'll be forced to close permanently. And then there are concerns that there won't be enough childcare when families return to work. What should we tell programs that cannot stay open? I think that is a very sort of real and palpable concern right now. I think overall, I don't think anybody has sort of witnessed the economic kind of phenomena, for lack of a better term, of the last 3 weeks in terms of what sort of happened across the board. You know, I think at the top level of government, the governor is working with the Secretary of Finance, is working with the General Assembly, you know, has been in between helping provide guidance on some of the policies related to childcare, has been talking to the bond agencies. You all are not alone in this concern. Small businesses, entrepreneurs across the state and across this country are in this like unbelievably kind of unexpected and unprecedented boat. And I think we're hearing more from the feds. I think kind of continuing to push for additional relief. And as we hear more from either the federal or the state level, bringing that guidance out to folks, helping people understand what that means for them. We know there are some places that are not going to be able to keep their doors open. The governor reported today that, you know, we are, you know, sort of, you know, several thousand more folks filed for unemployment, and, you know, we've reduced the sort of waiting period there. We know that's not ideal. We know that we want, particularly if we need childcare, and so I think we're trying to kind of match between where is there a need for childcare, right, and how can we match our existing providers who, you know, want to serve folks. But we also, you know, have to acknowledge that there's this, what's happening to our economy is unprecedented. Young has a question about, would you recommend an informed consent for parents to sign specific to COVID-19? Tara, do you want to take that, or is that, you know, more of like a question we're going to have to get back to people on?
Sorry, Jenna, who are you addressing that to?
To you, if there's an informed consent around for parents that they need to sign specific to COVID-19.
You know, I think that's not something that I honestly don't know that we've thought about it, but I think when you're considering individual centers, that would be an individual decision based on, you know, with their participants. I don't know that we would want to, you know, tell somebody not to do something. You know, I think those are just some decisions that have to be made at the facility or the provider level.
Thanks, Sarah. Jay Fry's point, I think, is similar to Jamie's. I work with a program that is afraid that they will not survive financially and will be unable to reopen again if they need to close for a length of time. Any thoughts on how to minimize the loss of the private providers? I think particularly those that don't take subsidies. As Barb talked about, one of the key priorities of the federal block grant is the subsidy program, which serves our lower income families that are working or in school, and there's about 25,000 kids across the state, and kind of has to be the top priority. But I don't think that means that we aren't kind of grappling with what's going to happen more broadly with the private sector of childcare. I mean, both in terms of the short term and how do we support these small business owners and these employees, but also in the long term as we shift into recovery from this pandemic. How do we make sure that the economy again needs childcare, right? You can't have a fundamental economy, you know, today or tomorrow without childcare. And so we're trying to, across social services and education, elevate those issues. We've talked with our workforce advisor, we're talking with the Secretary of Finance, we're talking with other folks, and we sort of think about kind of federal dollars coming down, making sure that child care and sort of recovering and restoring childcare is a part of that equation is going to be essential. There's Tara's email address. Thanks, everybody. Tizzy agrees with Jenna on it's irresponsible to not have testing for everyone. Monica raises a point about school closure and the risk to childcare providers. Are we doing a disservice to providers? Providers are being called to fill in the gap without resources and tools, and keep hearing we're professional, but this is not healthy working conditions. We need to hear that you have the providers and families' needs will be met. Again, Monica, I think the kind of, you know, reaching out to Tara, if we have sort of shortages of supplies, please let us know, and we can work with the Department of Health, again, to kind of figure out what's happening, what consortia are local, what supplies might be needed in order to better support your sites, your staff, and your families. Dory notes that she's feeling obligated to her 20 staff persons. She wants to remain open to ensure that we have some revenue coming in. Staff schedules are being altered due to low numbers and sending the group size of 10. What help is available that my employees can pursue for loss of income If we are forced to close and forced to pay staff for time off, we will not be able to recover or continue to provide our service for our 90 children. Thank you, Dorian. I know this is difficult, and again, we're trying to kind of balance on the best advice from the Department of Health and kind of limiting the kind of the sort of the contact among kids, and so that's the reason for that group size or that classroom size. I know sometimes that disaster unemployment can help with sort of percentages of unemployment, but let us take that question. I think we'll need to kind of, call a lifeline or get some additional support, but it sounds like certainly one of the things Barbara and Tara will need to follow back up on is folks are having to make really hard choices, getting them more information on what, what might be available to their employees if they have to temporarily close, go without wages, or kind of, or even more dramatic circumstances.
Jenna,
Sarah, here's a question on.
I think we've got one more question and one more comment, and then we'll wind it up. But thanks for persisting through answering every single question. And I think you're nearly to the end.
Great. So, and then I'm going to punt to Tara. So I think, Tara, the kind of question is around background checks. I'm going to sort of sneak two into one from Jocelyn and Patricia. But how do we get sort of new staff if we can't get background checks? And then what about sort of background checks aren't transferable? Is there any possibility of creating a sub pool?
So right now, we have not heard anything surrounding the fact that we can't do background checks. We we're trying to stay in touch with folks, with our field print contacts, and we haven't heard of any slowdown in folks being able to obtain fingerprint background checks at this point. I know that we're, as a part of state programs, which OBI, Office of Background Investigations, falls under state programs, and are working diligently to make sure that they can have the resources to continue to be able to operate in case of, other, issues with, if we have to work from home or if offices get shut down. So there are definitely plans behind the scenes to make sure that these types of things continue to operate, so that we can ensure that our workforce can continue and our child care providers can continue to obtain those, so that we can keep people working. So, there's all kinds of a whole host of things that we're looking at in a what if contingency. And so hopefully we won't have to go that route, but we do have a lot of things in the, on the back burner that, maybe we can look at in the future. But right now, I think, we're good. But if you hear something else, just, again, don't hesitate to reach out. But right now, I think in terms of our fingerprint backgrounds, I think we're doing okay with even still with the turnaround times and whatnot. That was the last word I heard.
Hey, I'm going to break Kathy's rules slightly. So, Tara, it looks like there might be some issues around field print being closed in the chat section, but I think that's, again, someplace where we can kind of look into pretty quickly and get back to folks on that. All right, with that, Kathy,
Yeah, okay.
we'll turn it back to you.
Okay. Thank you so much. We are capturing all of the questions, and we'll be kind of following up and asking our fearless leaders to see if they can run down any of the answers that they weren't able to before. I just want to give big thanks to Holly, Jenna, Tara, Barb for joining us tonight and answering so many of the questions. And the foundation is dedicated to continuing these conversations, and our colleagues at the state agencies and the governor's office have said that they would be willing to continue to have these conversations on different topics that are timely and relevant. So stay tuned for that for sure. We'll be providing a link to this recording probably by the morning, and we'll be doing that on social media and other ways that you can stay in touch with the conversation. And Holly, you want to close us out?
Sure, I'd be happy to. I'll end in part where we started with, which is just with a huge thank you to each and every one of you. As I think everyone has reiterated, we are just so appreciative of the work you're doing with children and with families in these very strange and difficult times. If we can be of any additional support to you all, please let us know. Don't hesitate to reach out with questions and concerns as this continues to evolve. And we'll work on getting through it together. Thank you all.
Well said,
I
Holly.
do have something I could add real quick, Kathy, on that field print question. Is we
Sure,
just
Kat.
found out that field print is communicating with us, and there's only been 2 closures, so we should still be good to go with our background checks.
Awesome. Thanks. That sounds great. Thanks everybody again for spending your evening with us, and stay safe, and thanks again for all the work that you do, and have a good evening.
Thanks, Kathy.